Hello, this is Joel Gonzalez and I am the product specialist for Megagen USA. In this video, we will be reviewing the AnyRidge restorative process, however with a slight review of the surgical process itself. Now, just as a review on the AnyRidge system, it is a bone level implant, which means surface roughness to the top. It has a 5-degree Morse taper built into the implant, which we'll be going over in just a second. It has a deep internal hex connection combined with the 5-degree Morse taper. And it is platform switch with all the prosthetics relative to the final prosthetics themselves. So again, we're going to be reviewing that in just a second. So what is the whole purpose of this new type of implant relative to the design with your smaller cores? Smaller cores basically mean more blood supply. In other words, you're taking less bone away and still achieving increased primary stability with this implant due to its very unique design. So let's look at the 3.5 diameter implant all the way to the 8.0. Your 3.5 diameter implant has a core of 2.8. Your 4.0 diameter implant and through 5.5 has a core of 3.3. And your 6.0 through 8.0 diameter implant has a core of 4.8. Again, you're removing less bone, but yet have greater primary stability. Look at your 5.5 diameter implant. Look at how wide the threads are, okay? Again, you're going to use this implant relative to a D4 type bony area. Your 4.0 implant is relative to a D1 or density 1 or harder type bone in the anterior mandible scenario, but look how small the threads are. So D1, D2, D3, and D4, 4.0, 4.5, 5.0, and 5.5. Your 6.0 is D1, your 6.5 is D2, your 7.0 is D3, and your two D4 implants are your 7.5 and 8.0. Again, look at the large threads. Now look at, if you would please, look at your healing abutments, your 4.0, 5.0, 6.0, 7.0, 8.0, and 10.0. Now, the one thing to emphasize with this implant system is everything is compatible within everything you see here. As an extreme example, your 10 millimeter flared healing abutment will fit on your 3.5 diameter implant. Now, you would never do that in real life. However, just to emphasize the point of compatibility, as another extreme example, your 4.0 diameter healing abutment will fit on your 8.0 and 7.5 diameter healing abutment implants here. So everything is compatible within everything. Now, why is that important? Because basically aesthetics or aesthetic control is at your fingertip. So what am I meaning? If you have a 5 millimeter diameter healing abutment in place, let's say with a larger diameter type implant, and you want to put a molar restoration on there, you have to have a larger type emergence profile. So what you can do is simply change it out from a 5.0 flared to then a 6.0 flared. And then let's say the patient comes back a week later, then change it out to a 7.0 flared type healing abutment. So because of the compatibility issues, you have really aesthetic control at your fingertips, because you can even change it out to an 8.0 or even 10.0. So everything is compatible within everything. There is a common connection within all 10 diameters of the implants themselves. And here, as an extreme example, here's a 10.0 flared healing abutment and a 6 millimeter flared healing abutment as well. But again, both of them are compatible with one another. So why is that important? Because there's no more choosing small platform, regular platform, or wide platform with other implant systems. You don't have to do that any longer because everything fits everything. The thing that you have to really look at now is what size tooth am I replacing, and choose the appropriate impression coping and so forth from there. So let's look at a molar process real quickly. Here is a very unique scenario because you have a 3-rooted mandibular extraction socket and molar. So there, in the old days, we used to have to remove this area here with a trephine and place your implant right in the center. Well, now we can use a drilling process. Here's your 3 drills that you would use and is your workhorse of what you're going to be utilizing with this implant system. 2.0, 2.9, and 3.3. And we're going to be utilizing these 3 drills here in this osteotomy. We're going to place a 5.0 by 13 implant because it's a molar, so we can place a 5.0 diameter implant in this area. There's your implant in place, grafted bone, and a large flared healing abutment here. That's a 7 millimeter flared healing abutment. Okay, so look at your large flared healing abutment and what your natural emergence profile is going to be for this molar. Look at that as far as the healing abutment goes and the implant relative to the implant diameter. Here it creates your nice, deep welling effect for your natural emergence profile, as well as your natural aesthetics that you will have relative to the final prosthesis. And again, there's your final crown relative to, again, the molar size that you're replacing. There you can clearly see the platform switching here on this particular implant itself. Okay. Again, to reemphasize, 4, 5, 6, 7, 8, and 10, everything fits everything, which is really, really nice. Your more popular size healing abutments that you will use are your 4, 5, and 6 height healing abutments. We do have your open tray pickup impression copings, both short 7mm height and longer 12mm height. There you can see the pickup impression screws. Now in the posterior, if you do like the pickup impression technique, in the posterior, these shorter 7mm flared pickup impression copings are key. Again, what did I just emphasize relative to the size? Everything fits everything. So your 4, 5, 6, and 7mm flared healing abutments all follow suit with your impression copings and your final abutments themselves. So everything has sort of an aesthetic contour naturally built into it, and everything follows suit relative to the diameter. One really nice thing about this implant system, an added bonus if you will, is for the laboratory, there's a blue laboratory screw in each final prosthetic package. Your blue screw is specifically for your lab. Your yellow screw or your gold screw is for your final prosthesis for your patient. So do not get the blue mixed up with the gold, because the blue lab screw does not torque down to your final 35 Newton centimeter for your final abutment, final torquing amount. Okay, again, blue screw is lab screw, gold screw is patient screw. There is a bit of confusion relative to the analogs. Every analog has the same prosthetic connection in there. But if you're going to do a molar type restoration and you're going to do a custom UCLA abutment, you need to see the natural emergence profile of your natural sized molar, for instance. So you need sort of a larger platform to be able to wax to. So that's why we have your 3 different widths of analogs. Your small, medium for blue, and large for yellow. So 4.0 through 5.5 is typically going to be blue, 3.5 is going to be purple, and 6.0 through 8.0 is going to be yellow. There's your 4mm abutment, 5mm abutment for the blue, as well as 6mm abutment for the blue, and your 7mm abutment for your yellow analog. Okay, we do have these really nice PMMA temporary abutments if you need to do an immediate provisional. Here's a case with a central incisor. We use the patient's own tooth for a final restoration, for a provisional restoration. There you can see it hollowed out, bonded directly to it. Index it in the mouth and pick it up, and then take it to the mouth for your final prosthesis, for your provisional prosthesis. And obviously, again, to reemphasize, 4, 5, 6, and 7, all having the same prosthetic connection for your flares of your different abutment options. We do have an abutment removal tool. Because this 5-degree Morse taper here creates a perfect hermetic seal, your abutment, once you torque it into place, cannot be removed by hand. You need to get this abutment removal tool, take the final screw out of the abutment itself, put this driver into the abutment, and it'll screw into the threads that are here in the abutment itself, and this portion here will bottom out on the implant here. And as you continue to screw down, these threads here will literally lift the abutment up. We do have different heights of abutments, 2, 3, 4, and 5. Again, every final abutment utilizes an abutment removal tool. So let's look at this case here. Here the implant has been placed. Second stage was done. Healing abutment was placed. Impression coping utilized to take the final impression. Here you can see the soft tissue model on the lab working model itself. You see the internal hex there. There it is seated. Nicely placed. Here is a really beautiful custom abutment from Precision Dental Arts in Albuquerque, New Mexico. The lab technician's name is Mike Sumner. Again, fabulous abutment because you can see the anti-rotation built into the actual abutment itself. And here you see the torque tip in with your blue tri-end or laboratory screw. So we're going to remove that in just a second. He also put a nice facial groove here for orientation. And you can see what I was talking about relative to the anti-rotation for the framework that for the crown itself, your framework here is built into basically a square aspect for more restoration, or excuse me, for more anti-rotation for your restoration itself. And that facial groove definitely helps to orient the abutment when you're placing it in the mouth. There it is seated. And again, emphasizing the anti-rotation of the crown itself. Now, here it is seated with your abutment, so you can see the clear margins, but again, that blue lap screw is still in there. So this is what your impression coping would look like if it were not seated properly. There would be a gap in between here, between the implant and the abutment, excuse me, and the impression coping itself, okay? And here, by the way, you would always place your analog in place first before you put your impression coping back into the impression. And that's a laboratory process. Now let's go ahead and seat the final restoration. Here what we did, we took a Q-tip and we broke it off and we put some blue mousse material into the crown itself. Once we did that, we put this Q-tip into the crown, and this is a little nice little trick to remove all the excess cement from the crown itself. So you can see the natural emergence profile of the impression coping relative to the final abutment. Here is your basically homemade die that we made, and it's the exact shape of the internal aspect of the crown. So when we go to remove our excess cement, it's going to be much easier to do. So we're going to take off the healing abutment. You can see clearly the internal aspect of the hex and the Morse taper of the implant itself, as you can see here. Here's the abutment being seated with your blue lab screw in place, and there you can see the facial orientation. There you can see the abutment being seated with some hemostats put into place, and then the blue laboratory screw taken out, and then your gold final patient screw being placed. Okay, now we're going to check the contacts, do everything you normally would do with your final restorations. And the whole purpose of us doing that whole process is to, again, have no excess cement underneath the tissue. This hand driver also, as you can see here, couples with your torque wrench. Now your torque wrench is engaging this. Now we're going to go to 35 Newton centimeters. There it's 15. We're going to final torquing measurement of 35. Okay. All right. Once we mix up our cement, we want that cement to be nice and creamy, as you can see here. It's nice and sort of gooey, but creamy yet. And that's a nice little test to do. There's your, now think about this. Where would all this excess cement be going? Underneath the tissue. So how about let's take it out. We'll get that die that we basically custom made, and all that excess cement is going to be coming out from underneath the crown. But again, that would normally be going underneath the tissue, which we don't want. And once we've done that process, you can put some cotton or composite or some ferment material or whatever you choose to use that to cover up that access hole. And we put some composite over that. There's your die, removing the excess cement. We can actually do it one more time to remove that little bit of excess yet again. And then we go to the mouth, and none of that excess cement is going underneath that tissue itself. Therefore, you have, again, complete control of your restorative process. Now, that whole thing is just a short synopsis of the final seating process itself. Again, utilize this guide, if you will, this picture as a guide for you. Relative to the size of implant, that's the type of restoration that you want to use. So if you're going to be doing a medium-sized restoration, you're going to want to use a 5 or 6. If you're going to do a lateral restoration, you're going to want a 4 healing abutment as well as final prosthetics. If you're going to be doing something for a molar size restoration, you're going to want to use 7, 8, or 10 healing abutment. But the final prosthetics that we have relative to the molar is your 7.0. If you have any questions whatsoever, please email me or call me at the cell phone number listed. And I do wish you all the best of luck in your private practice. And thank you very much for your attention. Have a good day. Bye-bye.